6 tips to help you shop for health insurance. Not all employers offer health insurance benefits, and if you're not getting insurance from an employer, you will have to shop for health insurance on your own. Unfortunately, buying health insurance is not as fun and simple as buying a new pair of shoes. Before you start shopping for health insurance, read these tips to help you make the process easier. Evaluate what is best for you and your family. Before you start shopping for health insurance, evaluate the needs of your family. Evaluate the amount of medical expenses you think you and your family will have. If, for example, you and your spouse are expecting a child this year, you can expect a lot of doctor visits and an expensive stay at the hospital. You may want to get a plan that can cover these expenses the most, even if it means shelling out more money initially. There are 3 health insurance plans to choose from. This is just the plans. You also have to choose the company your plan will be through. HMO, Health Maintenance Organization. Low cost. You choose a primary physician, and you must get a referral from your primary physician to see a specialist. PPO, Preferred Provider Organization. More costly than an HMO, but you are able to see a professional without a referral from your primary doctor. Often have the best in-network providers. EPO, Exclusive Provider Organization. Combines the flexibility of the PPO with the low cost of the HMO. You do not need referrals, but there is a limited amount of in-network doctors and hospitals. You should be careful to make sure the hospital or doctor is covered before seeing them. Evaluating your family's needs will help you choose between the 3 plans. For example, if you have a sick member of the family and they need to see a lot of specialists, you may want to choose the PPO plan that provides you the flexibility of seeing any doctor you want without having to get a primary physician referral. It may cost more than the HMO initially, but in the long run, it will pay off. If you have a great immune system and are trying to save money, you may go with the HMO. Contact your family doctor to see what coverage they accept. If you love your family doctor and cannot foresee having to change doctors, it is important before committing to any health insurance plan to see what health insurance your family doctor takes. That way you can choose a health insurance plan that will allow you to stay with your family doctor, and you can shop around between healthcare insurance companies that your doctor does take to see which has the best coverage. Even if you are paying an arm and a leg for health insurance, and you have been told by many people that the insurance you are purchasing is the best, do not assume that your family doctor will take it. Save yourself the headache and check with your doctor before making a health insurance commitment. Make sure the insurance company covers your normal medications. Obviously, you cannot foresee every medication you will need for the year, but if you have drugs that you take on a recurring basis, you should factor them into your decision when shopping. Make sure if you were to buy the coverage that your medications would have reasonable copays. Do not always get scared about high premiums. If you expect very high medical expenses, paying a high premium may be worth it. If you have a lot of medical expenses, the low copays and low deductibles will be more important over time. Higher premiums have lower out-of-pocket expenses. If you anticipate many doctor's visits followed by many prescriptions, do not let the higher premium fool you. You may actually save at the end of the day. Get a free quote online. Many of the health insurance companies provide free online quotes when you give them a limited amount of information. This will allow you to compare plans to determine which best fits in your price range and gives you the best benefits. Visit www.consumerreports.org, Health, Insurance, Health Insurance Plans.htm. This website will help you compare plans and see their rankings in consumer satisfaction. Do not forget about the open enrollment deadlines. Always check the open enrollment deadlines to ensure you do not miss the open enrollment periods. According to healthcare.gov, if you are going to enroll in a plan in the marketplace for coverage starting in 2016, the open enrollment period is November 1st, 2015 through January 31st, 2016. Only certain circumstances or events will allow you to qualify for this special enrollment period.